If you're tired of wearing glasses or contacts, you may want to look into LASIK. It's widely known that it can improve your distance vision, but if you're not a good candidate for, you want an alternative, not to worry, there is another option. Dr. Jeffrey Whitman of the Key-Whitman Eye Center is here to explain. Good morning, Dr. Whitman.
Great to be here this morning.
Always good to see you. So first, let's just go through LASIK. What is it, and is it a good choice for everyone?
Well, Jane, of course, there's not one treatment that's right for everyone, but if you're 18 years of age or older and you need your distance, your far-away vision corrected, LASIK can treat nearsightedness, farsightedness, and astigmatism. But there are a lot of patients out there that just don't want a laser treatment or are afraid of it, or they're just not good candidates for LASIK.
So why would someone not be a good candidate for LASIK?
Well, typically it's someone where the cornea, the front surface of the eye, is too thin for the amount of nearsightedness they have, or there's an irregular shape to the cornea. And for those patients, we'll either recommend no treatment at all or PRK, a surface laser treatment, where we use a chemical to remove the surface epithelium and then do a laser treatment, but it's more uncomfortable and it takes much longer to heal than LASIK does. Thankfully, at Key-Whitman, we have an even better option, even for patients that are good LASIK candidates.
Okay, so that's what I'm going to ask you about. What is another option? Because you just mentioned some problems for some people with LASIK. What's another option?
Well, for those patients, we have EVO LASIK, same one that one of the Jonas brothers recently have.
Okay.
And the EVO lens can treat small amounts to extremely large amounts of nearsightedness and astigmatism, more than we can treat with LASIK. And since it's placed directly into the eye, there's no laser removal of corneal tissue, there's no increase in dry eye, and it's all done in a painless procedure that takes less than 10 minutes. And just like with LASIK, you see better the very next day.
That's amazing. I mean, I'm just always amazed at all the things you can do now, because your eyes are such an important part of your life. So to have sight. ICL, is ICL, you've been doing that for a long time?
We've been doing that for many, many years. In fact, we're involved in some of the FDA research on the EVO ICL lens, so we knew how well it worked already. And now we just find that it's easier and safer for our patients to undergo than ever before. It's a great alternative to LASIK or PRK. In fact, it's kind of becoming our most recommended treatment for nearsightedness.
Okay, so EVO is something to remember if LASIK is not for you. Okay.
Exactly.
The good thing, so you have a number of different treatments and you have a lot of locations. You're near anybody in our area.
Yeah, we have locations all over the North Texas area. Just give us a call or get online and set up an appointment for that evaluation, and we'll let you know if you're right for the EVO ICL procedure.
Okay, and before you get away, can you remind our viewers of why that annual eye exam is critical?
You know, it's all about picking up problems early. A lot of significant eye disease had no symptoms to begin with, and if we can pick it up early, we can prevent the permanent loss of vision, and that's what we want to do.
All right, thanks so much, Dr. Whitman. Great to see you. If you are interested in EVO ICL or LASIK, give them a call now. The number to call is 214-220-3937, 214-220-EYES. You can also request an appointment at keywhitman.com.